So, almost on cue, as I've said, here's what's going to happen. Because there's several hospitals, oh, we can't afford it, we can't. I mean, I was saying this 3 years ago, this is what they do. So, here we go, everything I've been saying. Supporters of, as you can see, hospital regulation bill could clear path for Medicaid expansion. Yes, so congratulations, nursing unions and nursing American Nurses Association. Yes, thank you for being contributors to the pushing socialism down America's throats while you carry on about caring about patients. I don't think you nurses could care if you tried at the top there. No, this was it's so deliberate, and you're going to see more of this. This is how they will push one payer system in. And that will be the worst disaster ever. Supporters of legislation introduced in the state Senate to change how the state regulates healthcare facilities say their bill would allow more hospitals to open in rural parts of Georgia. Senate Bill 442 would repeal the requirements for a certificate of need or a CON that determines whether hospitals can operate in counties with a population less than 35,000. The bill filed Wednesday by State Senator David Lucas, a Democrat from Macomb, has bipartisan support. Of course he does, including from the Republican chairs, of course, of the Senate Rules Committee and Health and Human Services Committee. How nice, Republicans and Democrats all colluding. They don't care about America. They clearly don't know how to do what's best for America or healthcare. Originally, Lucas said he saw the value of CON as a way to protect small rural hospitals from being pushed out by big hospitals that would cherry pick their patients and leave the non-paying patients to the public hospitals. But now those rural hospitals are hanging on by a limb, said Lucas, whose district includes Hancock County, which has a population of less than 9,000 and has struggled to keep its hospital in business. In rural communities, you do not have the big corporations who can turn around and donate money and receive credit. To really address the healthcare needs of rural Georgia, he said the need needs to fully expand Medicare under the Affordable Care Act. It's everything I've said they were going to do. And CON has to be part of that conversation. Democrat supporters believe the bill, if passed, could entice Republican lawmakers to support Medicaid expansion in exchange. Medicaid is the government health insurance program for low-income people. Georgia has not accepted federal funding to expand Medicaid under the Affordable Care Act, remaining one of just 10 states in the nation to do so. If Georgia expanded Medicaid, the federal government would cover 90% of the cost of the expanded population, plus the state would qualify for an added incentive that would create a financial surplus. As of now, Georgia only provides Medicaid to low-income adults who meet certain criteria, such as those who are pregnant or on disability. Governor Brian Kemp launched Georgia's Pathway to Coverage last year, which expanded eligibility for low-income people who work at least 80 hours per month or perform certain specified activities. But some 300,000 adult Georgians remain uninsured. Some Republicans, including Lieutenant Governor Burt Jones, have expressed a willingness to consider expanding Medicaid if changing CON rules is on the table. However, Monty Veazey, president of the Georgia Alliance of Community Hospitals, said the bill was built around faulty reasoning. It's not going to help rural hospitals. Nope. The only thing it would do is hurt them. Absolutely. Large, wealthy hospitals would be likely to establish themselves in rural areas, Veazey said, because there wouldn't be enough patients to justify the cost. An easing of CON rules would be more likely to attract ambulatory surgical centers, which provide freestanding outpatient surgical care. Those centers, which are often backed by private equity, typically only accept patients who can pay for services or who have a private insurance plan. That set up, he said, then leaves the rural hospitals to care for patients who have Medicare and Medicaid insurance, as well as those who don't pay at all, instead of serving a diverse clientele. Well, the fact that he used the diverse word there, I wouldn't trust him, because he's not saying the truth. That what this is, I'm telling you what it is. It's a forcing of America for all on everyone. Now, they'll say if you don't want it, you don't have to have it. But do you think it will stop there? They've already brought this mass amounts of the socialist system through the Affordable Care Act. And I mean, an American Nurses Association couldn't be any farther up Obama's butt with that plan, and it's been the worst thing for healthcare. I've been in it long enough, I know. There was better quality of care. The hospitals were run better. We had plenty of staff. Was it perfect? No. But when Obamacare came in, the whole damn system is tanked, which is exactly what it was designed to do, so that the Republicans and the Democrats, the enemies to the country, the enemies to healthcare, in my opinion, can force. Because this is why they are doing this. This is why the manufactured decline. We have to close. We can't afford, and the federal government and this and that. Oh, we could just have to bring in sweeping Medicare for all, so that then we're in a Venezuela system. Then it's too late to do anything about it. Thank you, American Nurses Association and National Nurses United and all you globalists. Eventually, those rural hospitals often close, leaving low-income patients with fewer options for health care. Senate Minority Leader Gloria Butler, who signed on to SB 442, explained before her colleagues Thursday that reversal of her deepest held and most profound belief to preserve the Khan law. While the Stone Mountain Democrat said she has felt that Khan laws ultimately protect patients, these people don't even have a clue what protects patients. I mean, these people are listening to lobbyists that American Nurses Association and Medical Association send in there that just tell them a bunch of nonsense. Butler said changes in healthcare markets have reduced access for rural patients. Those changes have her considering relaxing the state's Khan rules to give rural patients new innovative healthcare options. Still, she wants to see the conversation in concert with Medicaid talks. Only when combined with full traditional Medicaid expansion, reforming Khan will help our rural Georgians access healthcare without losing more hospitals in the process. Butler's counterpart in the state House, Minority Leader James Beverly, backed down on demanding full-scale Medicaid expansion, saying he would be open to a waiver plan that could involve purchasing private insurance plans for eligible recipients on the Affordable Care Act. No, none of these people are saying what they should. Ditch Affordable Care. Ditch Obamacare. Start getting honest, you politicians, but I don't expect any of these people to get honest. Beverly, a Democrat from Macomb, said he also saw an opportunity by agreeing to ease Khan requirements in rural areas to improve maternal mortality rates. So I'm not going to go. That's pretty much it. Not one person, Republican or Democrat, said the truth. That this is manufactured. I've said for 3 years now, they're doing this on purpose. They're creating unsafe situations in the hospital. They don't have supplies. It's a manufactured thing so that it doesn't look obvious. But they're deliberately doing it so that the government has to come in, and then the only fix is Medicaid for all. It's the worst thing to happen. Obamacare's been the worst thing that happened. No matter how much you read otherwise, I'm telling you, I know what healthcare was like before Obamacare. We had an ethical, decent system. Was it perfect? No. But with these kind of Republicans and Democrats and the American Nurses Association and Medical Association telling these people what we need, which all they ever say is Medicare for all, well, what they've really done is just say, we don't care what we have to do. We're going to be nurses and say, well, you need to destroy your country so we can have what we